Hi everybody. So today we'll be talking about hypertension. In the beginning I would like to mention that hypertension actually is an easy topic. It's not very difficult. It is easy, but it is one of the most important topics. So every doctor, even the doctors who are not specialized in cardiology, have to understand it, have to know what is hypertension. Today we are going to discuss a few important things. They are not the major, but few important things, and then we will go further with the most important things, with the more important things. So, what is hypertension? Hypertension, or maybe we can give a sample for it as HTN or HT. So anywhere you find HT, that means hypertension. Of course, systemic hypertension is not pulmonary hypertension. It is systemic. It's arterial hypertension. Everywhere when you hear the word hypertension, that means systemic hypertension, arterial hypertension. But if they will add the word, for example, pulmonary hypertension, then we can understand pulmonary. So the word hypertension alone means arterial hypertension. So also known as high blood pressure, is a long-term medical condition in which the blood pressure in the arteries is so elevated. When the blood pressure is elevated, we call it hypertension. How we check blood pressure? How we check blood pressure? This is one of the questions that we are going to discuss today. Important question. What's wrong with the computer? So, why we check blood pressure? What is the normal range of blood pressure? And why? So the question is that, what is the normal range? I think everybody will be answering 120/80. It's correct, but you have to remember in medicine we always have range. So it should be from to. So we will talk about the normal blood pressure, no worries. But why do we call this normal blood pressure? For example, if somebody will come with 100, let's say, 150/100, we will say, yeah, high blood pressure, problem, we have to fix it. But why? Why did we decide that this is a problem and this is not a problem? What is white coat syndrome? It's something funny, you have to know about it. So, how to check blood pressure? As you see in this picture, we have the major arteries, like carotid arteries, the subclavicle arteries, then the aortic arch. So generally we check the blood pressure in the right and left hands. How we check the blood pressure? There are two major ways. The first way, I'm not going to explain it, is just you start checking it. You can find videos about that, you can read, you can do some practice, and you can understand how to check blood pressure. But there is a way that always doctors, cardiologists, maybe they ask you in the exam to show that they are smarter, or just to tell that you have to know something in addition. For example, like they don't hold a stethoscope, but they can check blood pressure. So how they do it? So here where we check the blood pressure, I will explain how we do it. So, when you start checking the blood pressure, just instead of the stethoscope, don't use the stethoscope, put your fingers on the carotid artery to check the pulse. Then start pumping, start inflating, till the moment that the pulse will stop. Then start deflating. With time, you have to feel the pulse. As soon as you start feeling the pulse, that means this is the systolic. And as soon as the tone of the pulse will be changed, this is diastolic. It is something not that important, but sometimes you don't have stethoscope, sometimes you want to check it just without stethoscope, and sometimes this question is a question actually in the exam. So like 3 or 5 days ago, I was just going for a tour, and I have seen a cardiologist with one of the students, and she asked the student, actually he was not a student, he was an intern, and she asked him to check the blood pressure. Then he asked her for her stethoscope. She said, I cannot give you my stethoscope, check it without stethoscope. So he had to know that. So I had a question, why what is the normal range of blood pressure? Let me go to the normal range, then I will come back to this picture, no worries. So this is actually a picture have been taken from what is called Fallbuch in Medizin. It is a German book for preparation for the Kantinsa-Prüfung, for the German license examination. What is the normal range of blood pressure? So the optimal, the exact or the best blood pressure that the patient should have is less than 120 over less than 280 for systolic and for diastolic. We can calculate that this is normal by if the range of systolic is 120 over 120 to 129 over 80 to 84. You can surely remember 120 to 130 and 80 to 85. Here is written hoch normal. It's in German. Actually, in English, it's the upper normal or the higher normal. Upper normal. It is 130 over 140, let's say, and 130 to 140, and 85 to 89. So both are normal. Remember, 120 to 140 and 80 to 90. So you add 20 here and you add 10 here. So 20 in systolic and 10 in diastolic. Do we go further? The grade 1 is 140 to 160. The diastolic is 90 to 99 or 100. So we add 20, we add 10. We add 20, we add 10. We add 20, we add 10. So the same. What I mean by adding 20 and 10 is a method that you will not forget. For example, somebody will tell you 140 over 100, 141 and over 100. What you will think about it? You cannot actually remember. So what you will remember is that 100 to 140 is normal. So we add 20 to end the stage of the first grade. So 140 to 160 is the first stage. I don't know if I made it complicated. Maybe here are the numbers, you can just remember them. Of course, you will find another categories, another guidelines, which will say, for example, like pre-hypertension, hypertension, upper normal hypertension, grade 1. Everyone can choose the grade that he likes or the system of the hospital that he's working in. So why we are saying that this is normal and this is not normal? From where did we get that? We go back to our picture. So we got that from that when the blood pressure will be higher than 140 over 90. As soon as the blood will be higher than that, the problem in the body will start. We call them end organ damage. So as soon as the blood pressure will cause end organ damage, that means the blood pressure is high. And from that we got that the blood pressure should be lower than 140 for systolic and lower than 90 for diastolic. Remember something. There is something really important, by the way. Do you know that 25% of population in the US alone is having hypertension? It is about 50 million. It's too much. It's too much, actually. But remember that 30% of these 50 millions are asymptomatic, especially in the early stages, and they start being symptomatic when they cause end organ damage. No worries for the people who are just studying hypertension. No worries. I'm going to explain everything in detail. I just want to give an overview about the hypertension. Then we will go to each part to each word, and we'll repeat it, and we will go very deep, and we will explain everything by detail. So no worries. So as soon as we will have end organ damage, then we will start feeling hypertension, but it is dangerous. So we have to check our blood pressure regularly. Now we will start. What kind of end organ damage that we have to remember? It is actually 5 things, 5 fingers. Remember the 5 end star. Remember anything you like, just 5 important things. The first one is the heart. What problems we can get from the heart with hypertension? Maybe left ventricle hypertrophy. It is one of the most important complications of hypertension. So we will get hypertrophy of the left ventricle. By getting hypertrophy of the left ventricle, the problems will start step by step. Hypertrophy is not an easy problem, because by hypertrophy you will get left ventricular failure. The oxygen required for the muscle will be higher than the supply itself. So you will have maybe coronary heart disease, maybe you will have ischemic heart disease, and then you will have maybe angina, myocardial infarction, arrhythmias, and even maybe sudden cardiac death. We will go to each of these diseases, to each of these problems step by step, and we will explain them. Then we will go, for example, to the CNS, the nervous system. There we will have problems as well. What problems? Here we can read hemorrhages, stroke. But do you know what is stroke? Can you define stroke? So, if we will have let me just put it in that way. Due to any vascular events, rapidly development of neurological dysfunction which lasts less than 24 hours and which completely recover. So in case that we will have, because of vascular events, we will have problem with the central nervous system, but during the 24 hours, actually less than 24 hours, and this problem would be recovered. Any problem will be recovered. This is not a stroke. We call this TIA, but not stroke. TIA is transient ischemic attack, actually. Transient ischemic attack. It is very dangerous and it is very important. So when your patient will have this, or one of your relatives or somebody you know, they have to go to a neurologist. They have to understand their problem, because it's really serious. It goes no symptoms anymore, but TIA is really important to get it fixed. But if we will have, of course, due to vascular events, rapidly development of neurological events or dysfunction which last more than 24 hours, or we got death during these 24 hours and the problem doesn't recover completely, we call this stroke. This is important. The difference between stroke and TIA, you have to know it. Then we have maybe hypertensive encephalopathy. We will talk about it. Dementia, we will talk about it as well. Then we will have retinopathy. Retinopathy is important as well. So the third end organ damage can be in the retina. So yeah, retinopathy. In vascular, of course, peripheral vascular diseases we'll have, because hypertension is one of the main three reasons for atherosclerosis. So diabetes mellitus, hypertension, and lots of other stuff, but it's really important for her. In kidneys, we will have heart failure, we will have proteinuria, and other more problems. This is the main thing that I wanted to tell you about hypertension. In the next video, I will try to explain hypertension from the beginning. We will go through everything that we have talked about here. I will go to something very important. I will go to something called, I forgot to talk about white coat hypertension. So white coat hypertension, easily and very fast. Hypertension, when the patient comes to the hospital, he don't have hypertension, he don't have any problem, so we don't really need to do anything for him. But the problem with that patient, when as soon as he sees a doctor or a nurse, he gets hypertension, high blood pressure. So the best way with these patients to give them blood pressure monitor for 24 hours. So and of course, you have to check the blood pressure after getting the patient relaxed from the stairs, from any stress. Maybe he have to lie down. You have to talk to him for a few minutes in the beginning, and of course you cannot check the blood pressure once and then you decide, yeah, he got hypertension. No, of course, both arms more than three times, and then you get the optimal. Then of course it's better to give him to check 24 hours blood pressure. The next video we will talk about, which is very important, about primary hypertension. What is primary hypertension? And we can just do it very fast. So we have like the major two types of hypertension: primary hypertension and secondary hypertension. In primary hypertension, remember the main difference in primary hypertension and secondary hypertension. The primary hypertension is not removable. It is genetic and environmental disorder. We will explain it. What does that mean? And not curable. So the patient with primary hypertension will be taking antihypertensive drugs time life. The secondary hypertension, it is removable, curable. Nice picture I got for you. For example, the adrenal medulla, if it will get pheochromocytoma, the pheochromocytoma would release more adrenaline, or we will get more adrenaline. That means more blood pressure. Pregnancy will increase blood pressure. Hyper and hypothyroidism will increase blood pressure. Maybe some of you will say, no, just hyper will cause hyperthyroidism. No, hyper and hypo, both of them will cause high blood pressure, and we will explain how in the next videos. Renal artery stenosis. Renal artery stenosis is a very important factor which can increase blood pressure by increasing renin or by different methods. We will explain it as well. So secondary, as we said, is removable, is curable. So if you will have, for example, pheochromocytoma and you will remove it, blood pressure is fixed. Pregnancy, get rid of it. I mean, after delivery, you will be fixed. The blood pressure will be fixed. Hypothyroidism, remove it, do something, you will fix it. Renal artery stenosis, you will fix it. Of course, parathyroid problems as well. So we have different. These are just examples. These are not all of the reasons for secondary. And remember something very, very, very important about primary and secondary. The patient should be between 25 and 55 years old to get the essential or primary hyperthyroidism. For example, if the patient got hypertension in the age of 24, 23, 22, so before 25 or after 55, that means you have to be very careful, and you have to look for the secondary problem, secondary reason for that. So tomorrow we'll be talking about something very important, which is the factors will influence the blood pressure, cardiac output, and total peripheral resistance. This is the main thing that you have to know in hypertension. So cardiac output, for example, cardiac output means systolic, peripheral total resistance means diastolic. We will understand how we influence this with cardiac output. Why is it systolic? Why is it diastolic? How we fix them, how we treat them. Please, we will be with us in the next videos, and I think you will get lots of things to learn. Thank you very much for your time. Have a lovely day. Bye bye.